Hi, I'm Colton Dunn. Think about the last time your bladder changed your plans. A walk cut short, a drive skipped, scanning for the bathroom before you sit down. For a lot of men, that's just how life works now, but it doesn't have to be. If you've been treated for BPH and you're still rushing, still up at night, still dealing with urgency and leakage, that might not be treatment failure. It's probably not just age. It might be overactive bladder, common in men and commonly missed. Let's meet some men who know exactly how this feels.
My name is Robert. I'm 63 years old. I live in Albuquerque, New Mexico. I first noted the symptoms when I would visit Albuquerque, and they just progressively got worse until finally I went to see a doctor.
Yeah, hi, my name is James, and I'm retired now. And I used to have an issue waking up 2 or 3 times a night to go pee.
Okay, my name is John, and I live in Country Club Hills, Illinois. I had these urgencies to actually use the washroom, and what would happen is by the time the urgency hit me, it was too late.
What you just heard, the urgency, the frequency, the way it takes over your plans, that's real, and it matters. For men already being treated with BPH, it can be confusing. Now let's hear from the expert about what's actually happened.
Hi, I'm Dr. Kuang, the founder of Man vs. Prostate. We want to talk to you about BPH. It's a fancy medical term for benign prostatic hyperplasia, but let's break it down. As men get older, we all have prostates, and those prostates get bigger, but not only do they get bigger, but they actually get tighter. They start off about the size of a golf ball, but in the shape of a donut. So as men get older, that donut hole is going to get tighter, and it's actually going to squeeze the main water pipe through which the urine comes out when you go to the bathroom. But there is actually a second part to this story, and that is your bladder. And its job is to be able to squeeze and push to get the urine out of your body. But over time, that bladder can become dysfunctional. It starts to struggle as the man's prostate's getting tighter and tighter. The bladder muscle has to work harder and harder, causing symptoms of urgency, frequency, nighttime urination, and sometimes even leakage. In fact, 50% of men around the age of 50, and sometimes 80% of men by the time we get into our 80s, are suffering from these symptoms.
Here's what most men don't tell you. You can have BPH and OAB at the same time. And treating one doesn't always take care of the other. That's why a prostate medication may still leave you feeling like it's not enough.
So when you're talking to your provider, you can now break it down. Hey doc, how do I now best manage the symptoms from the donut hole, my prostate getting bigger and tighter, but also how do we manage together? What are the strategies to help my bladder work better? One way you can really help clarify the conversation with your doctor is to use something like symptom scores. They help you put your symptoms into a framework that both you and your healthcare provider can look at together, because good data drives good decision making.
Every night I get up probably every hour and a half to pee. And then even after I peed, I still feel like I had to pee. And it got to the point where when I went to a restaurant, first thing I had to do was find out what the restroom was. When I'm driving, I had to have an empty cup in my car just in case I got caught in traffic and I had to pee.
And I felt like a zombie during the day. And then certain times during the day, I seemed like I had to run and pee, and I was really exhausted.
Well, I effectively had to figure out where bathrooms were because it's kind of embarrassing when you're out and around and it hits you and you don't have any control. It kept me from going out to places. It affected what I wore in terms of clothes and color because like most people that have suffered from incontinence, black is the color because anything else shows straight through. It's like being a 3-year-old all over again.
This isn't just getting older, and it doesn't go away on its own. And it's not weakness. It's not a failure. It's a medical condition with a name, and it can be addressed.
There are only 2 major organs you cannot transplant, your brain and your bladder. You only get one bladder, so let's take care of it. And just like the heart can speak to us. with chest pain, shortness of breath, or if the pain is radiating down your arm, you know that, oh my goodness, my heart's in trouble. My heart is talking to me. The bladder muscle is doing the same thing. Urgency, frequency, nighttime urination. That's your bladder talking to you, saying, hey, I'm struggling here. I need help. Please see a doctor, because identifying the problem earlier allows you to have better diagnostics earlier, which makes better decisions with better outcomes.
My life now is about how it was 10 years ago. I sleep all night. I can go on any kind of road trip I want to go on. I can go to a movie without having to get up. I can go to a concert without having to get up. It just changed my whole life completely. So basically, I just wanted to get as much normal as I could so I could go back to living, doing the things I like to do.
Life is so much better. Generally speaking, I sleep all night long. I'm well rested. I feel a lot better. I can do everything I used to want to do.
3 quick things for you to know about your bladder health. Number 1, first of all, I need you to prioritize that your bladder health is important. You deserve to live the best version of your life, incontinence-free, without urgency and frequency. Number 2, start tracking your symptoms, maybe on a notepad, on the refrigerator, or you can even go online and find some of those symptom scores we talked about and fill it out ahead of time. And number 3, make an appointment. Talk to a healthcare provider saying, hey, I'm having these symptoms about my prostate. I'm having these symptoms about my bladder. Hey, what are the management strategies we can use to make these both better?
You just took an important step. What you've been living with has a name, and that name isn't getting older. Before your next appointment, jot down what's been going on. How often, how urgent, how it's affecting your sleep. Bring it in and ask one question. What about my bladder? That single question to your doctor could be the one thing that moves you from resignation to relief. Watch the next video to learn how to start the conversation.